So good morning, everyone. I'm Yu Liu from Singapore National Eye Center, and today I would like to share with you neuropathic corneal pain (NCP) after refractive surgery. Neuropathic pain is defined as pain initiated by the primary lesion of the nervous function, and if neuropathic pain occurs in cornea, we call neuropathic corneal pain (NCP). Clinically, patients typically present pain, but we see no staining or minimum staining on the cornea, so we call pain without stain. If we look at the etiology, refractive surgery is actually one of the common causes. NCP occurs around 11% after LASIK or PRK according to the literature. However, the knowledge on who are the more susceptible for development of the NCP, particularly after smile surgery, is still very limited. So this study is trying to identify the risk factors for NCP after refractive surgery, and we also want to report patients' clinical manifestation, imaging, as well as the proteomics profiles. This is a one-year longitudinal study recruiting 50 smile eyes, 50 LASIK eyes, and these are the diagnostic criteria: presence of the pain or pain-like symptoms, abnormal nerve findings on confocal scans, and minimum or no stainings. All the patients received comprehensive ocular surface assessment, and we also did the confocal scans to look at patients' corneal nerves matrix as well as epithelial cells, and we also collect patients' tears for proteomics analysis. And these are the softwares we use to analyze patients' corneal nerves images as well as epithelial images. Let's have a look for the results, and we found that NCP occurs around 13% after smile, 11% after LASIK. Statistically, they are comparable. And we found those who have NCP have significantly lower corneal nerve fiber length, as well as higher corneal nerve fiber width compared to the non-NCP patients, suggesting the underlying neural inflammation because the nerves become more swollen. And we found that photosensitivity and burning sensation are the two most common symptoms in these NCP patients. Around 18 of the patients have their quality of life significantly affected because of the pain. And if we look at the underlying tear neuromediators, we found these NCP patients have higher concentration of the substance P, NPY, NGF, CGRP levels, again suggesting the underlying neural inflammatory status. And we also identify several significantly up and down-regulated proteins, and they are mainly related to the axon differentiation, neuropathic pain, or inflammatory status. And more importantly, we identify the risk factors for NCP after refractive surgery, and we found that for those who have LASIK surgery, those who have lower corneal nerve fiber density as well as lower nerve fiber length before the surgery have higher chance to develop NCP after LASIK surgery. While in SMILE, we found that patients' preoperative MRACE is significantly associated with NCP after SMILE. The higher of the MRACE, the higher chance of to develop NCP. So, for example, if a patient came for -8 SMILE surgery, this patient have 9 times more likely to develop NCP after the SMILE surgery. And Dr. Anna reported a similar incidence. They report 11% after PRK or LASIK. They also identify several risk factors. Those patients who have pre-op ocular pain, pre-op functional pain disorders, or those who have neuropsychiatric conditions are significantly risk factors. So to summarize, NCP occurs around 13% following LASIK or SMILE, and those who have a higher pre-op MRACE, those who have poor pre-op nerve status, and those who have functional pain syndrome, pre-op ocular pain, psychiatric disorder before the surgery, those patients we need to pay more attention to because they are more susceptible to develop NCP after surgery. And the proteins and neuromediators I present just now has the potential to be used as the biomarker for disease severity or the therapeutic targets for NCP after refractive surgery. Thank you for your attention.